Doctors of Reddit, what is the most bizarre issue you've seen a patient trying to hide or mask? Does your child have any medical conditions? No. Takes rest of history, makes basic plan for child's fever assuming probable virus based on the history. Any medications that he takes? Just the folic acid and penicillin. So, your child has sickle cell. Oh yeah. Completely scrap plan, start over. Fever in a child with sickle cell can be a serious problem and needs a much more extensive evaluation. It was a rookie intern mistake to not ask about the meds earlier in the convo, but still I would have expected her to mention the sickle cell up front since it was his hematologist who stressed to her the importance of always going to the ED when he got a fever. Not a doctor, but when I was working as a med tech in the ER, we had a male patient 75 come in with an extraordinarily low blood pressure, think 70/40ths, and a ton of facial and upper body bruising. He was brought in via EMS after the nurses at his nursing home found him on the floor in his room, where notably there was some blood on the wall. The guy wouldn't talk to us regarding why he was there, but was very talkative in terms of pretty much anything else, sports, the news, etc. We couldn't for the life of us figure out what happened since we couldn't find any bleeding internally, his fluid levels were fine, and he had not left the nursing home, so there was nothing available for a high mechanism of injury. We eventually were able to get him talking, after 4 hours, and he confessed that he had wanted to commit suicide and had taken the remaining amount of his prescribed nitroglycerin, used for chest pain, lowers your blood pressure rather quickly. Nitro is also the active ingredient in dynamite, but the amount in the pills is minuscule compared to what's in dynamite, and had tried to blow himself up by running into the wall repeatedly. He was a really nice guy that sent a card to us after everything, he was just extremely lonely. Edit, grammar and changed TNT to dynamite. I admitted a guy for pneumonia, which was odd because he was young and strapping, no other medical issues, X-ray didn't look quite right. The pieces just didn't add up and so I started questioning him more closely. Me, do you use any drugs? Patient, drugs. That's disgusting. I'm no druggie. I've never touched drugs in my life. I move on to other questions and suddenly. Patient, look, doc, I just want you to know I may have used cocaine once or twice years and years ago. I just snorted it though. That wouldn't cause this, right? Me, how long ago? Patient, like 10 years, maybe longer. Me, it shouldn't be affecting you after this long. Patient, more like 5. Me, years? Patient, like 5 months ago. This goes on forever, until he admits he just got off a massive crack binge the day before, where he spent the past 3 days in a hotel with some loose women smoking crack non-stop. He finishes with, but I don't want you to think I'm one of those dirty druggies. No, I think you're the idiot who lied and was getting treated for pneumonia instead of getting the proper treatment for crack lung, which is what he had. Here's a tip, I genuinely don't care. I'm not your mama, your spouse, or your priest. Don't waste my time and endanger your health spewing whatever horrible twisted thing you think is too shameful to talk about. I promise you, I've seen worse. Not so much bizarre as clever. I drug tested a patient who should test positive for opiates as I prescribed them. We do that too. The urine looked totally normal but the test came back bizarre. Had an insanely high specific gravity, means there was a lot of stuff dissolved in it. Sample was positive for opiates but had 0 confirmatory metabolites, what your body turns the drug into, in it. Otherwise test was totally normal. It took me a couple minutes to figure out how this was possible. The patient was selling their pills instead of taking them and didn't want to get caught. They crushed up the pill and put it into the urine. This made the test positive for opiates but because it had never gone through their body the testing machine found no metabolites. I use the case to find the smart med student in a group now lol. My aunt is a family doctor so patients come to her with symptoms and she directs them towards a specialist based on her diagnosis. One day an elderly husband and wife came into her office, and when asked why they had come in, the wife responded, "His foot has been smelling for a while and I finally convinced him to come have it looked at." My aunt, not hard of smelling, concurred that his foot stunk. She asked him to remove his shoe and sock. When he removed his sock, the bone from his big toe fell out of his toe and onto the ground. Turned out he had a very bad case of gangrene that had eaten away the flesh of his toe. He knew something was wrong but was stubborn and didn't get it checked sooner. And my big toe hurts now after typing this. My mother, the medical professional of our family, had a 13-year-old girl who was 9 months pregnant, in the midst of labor, dilated to 10 centimeters and crowning in the emergency triage, swearing until she was black and blue that she was a and that nobody knew what they were talking about. Her mother stood on the sidelines causing a commotion, demanding a real doctor make an appearance. Let's just say when the twins made an appearance 10 minutes later they were all singing a different tune. I met a teenage girl with a full-term pregnancy ready to give birth, but her boyfriend insisted the baby was premature because they only had 6 months ago. After the baby was born, he just said that the baby grew really fast. Shurei. I don't understand why people keep denying the undeniable. If your doc tells you that you are about to give birth, insisting on never having and being a is quite pointless. Not sure of this particular girl's situation, but it's very possible that she actually believed that to be true at the time. It's called pregnancy denial. And is considered a mental illness, I guess. It's pretty rare though, so I'm inclined to think that adolescents just don't always have proper foresight and she was just trying to stay out of trouble and so stuck to her story. She could also live somewhere that doesn't provide proper education, as that's a risk factor in young teen pregnancy. Alternately, she could also have been drugged/persuaded to get drunk and then was taken advantage of. So it's possible that she didn't know. Just extremely unlikely. My cousin told me about a patient who complained about her falling off all the time. She said she tried to glue it back on or use skincare creams to have it stick to her. Turns out she had, not sure what stage anymore, probably pretty bad, cancer. From what I remember, the tumor got so big that the skin was stretched quite a bit. Somehow that plus friction led to an open, not healing and oozing wound which extended to her. Well, nobody there understood how she didn't go to a DR or a hospital earlier. Keep in mind this happened in Germany. She had a job, health insurance and everything. Internal medicine ward outside of NYC. 55Y/O lady was mute in the ed, noted poor historian, but severely constipated, severe abdominal pain, needed rectal disimpaction and more than just an acute workup, so gets admitted reluctantly to surgery. Next morning on rounds she is talking a mile a minute, full of detail about her diet and symptoms and family, etc. Afternoon, back to mute, and back to abdominal pain and constipation. 2 more days, same pattern. Team is stumped. She is blown away that we can't figure out what is wrong with her, and we feel the same way. Labs, imaging, consult teams, all coming up empty. Strict ins and outs, strict dietary restrictions, everything we can think of. Janitor comes in by chance and is pissed he has to change the paper towels so many goddamn times in this one room, seems like the whole floor is stealing them from her. Sure enough, PT has been consuming about 2,500 paper towels Q2 for HRS. Psych team comes for the obligatory consult, and of course she is mute. How do we get her to talk? 1 paper towel at a time. I think some poor intern got a paper out of that case. Hope she is doing well somewhere. Not sure if this counts as hiding, but a patient we recently had tried to play off a rampant staph infection as just some leg swelling. Turns out what he meant by that was he had a horrible infection in and around his genitals, something known as Fournier's gangrene. Do yourself a favor and don't Google that. The swelling had gotten so bad that his penis had literally inverted. He later told us that he had to pee with a 5-gallon bucket held up to his crotch because he no longer had any idea where the pee was going to go. Edit. Since so many people are asking what happened, he went to emergent surgery within hours, which is likely to be the first of many. Only way to get rid of an infection like that is debridement in the OR plus a ton of antibiotics. Somehow this guy had no systemic signs of infection, fever, low blood pressure, etc., so thankfully he should pull through. Last I heard he was likely to lose one of his testicles, but I don't believe they were going to have to remove his whole penis. I know it's fun to talk about how gross this stuff is, but it's a very serious type of infection. This guy's life was definitely in danger had he waited any longer.